You have been lied to about your stomach, not with bad intentions, not always, but lied to nonetheless. You were told that the way to fix a soft, weak, pouching midsection is to train it harder. More crunches, more sit-ups, more planks, more everything. And if training didn't work, then the next conversation was about surgery. Those are the two options that get presented, and almost nobody stops to tell you that one of them is making you worse by the day, and the other one addresses the surface while leaving the real problem completely untouched. There is a third path. It does not require equipment, it does not require a recovery period, it does not cost anything, and it works in a way that the first two options simply cannot, because it works with the biology of what has actually gone wrong in your body instead of fighting against it. Welcome to Wellness Daily. Stay with me for the next few minutes, because if you have ever been told you have a separated stomach, or if you have suspected it but never had a name for it, what I am about to share is going to reframe everything. The condition is called diastasis recti. The word sounds clinical and complicated, but the reality is mechanical, and once you see it, you cannot unsee it. Your abdominal muscles are not one single sheet of tissue running down your front. They are two parallel columns, one on either side of your midline, running from your ribs down to your pelvis. Holding those two columns together at the center is a strip of dense connective tissue called the linea alba, which translates simply as the white line. That strip is not muscle. It is the same type of material your tendons are made of, fibrous, strong when healthy, and entirely load-bearing when it comes to keeping your core wall intact. When the linea alba is tight and healthy, your core functions as a closed system. Pressure generated inside the abdomen gets absorbed and distributed across the whole structure. You feel stable, you feel strong, the muscles work together. When that strip weakens, and it weakens in a specific way, it does not tear, it stretches, it loses its tension. The fibers become disorganized, slack, and unable to resist the outward force the abdomen generates every time you move, breathe hard, lift anything, or change position. The two muscle columns begin to drift apart. A gap opens right down the middle of your stomach, and that gap is diastasis recti. Here is what I need you to understand before we go any further. This is not a condition that only happens to women after childbirth, even though pregnancy is the most common cause. Over 9 months, a growing uterus puts enormous sustained stretch on every tissue in the abdominal wall, including the linea alba. In women whose connective tissue is elastic and robust, the tissue springs back after delivery. In women whose connective tissue was already on the weaker end of the spectrum to begin with, it stays stretched, the muscles stay separated, the gap does not close. But men develop this, teenagers develop this, people who have never been pregnant develop this. Years of carrying excess abdominal weight puts the same kind of constant outward load on the linea alba. A lifetime of high-pressure abdominal exercises done without proper technique puts the same inward force through the midline that pregnancy does. Chronic straining, rapid weight changes. The mechanism is the same regardless of who you are. The tissue gives before it should. And here is where the damage happens, quietly and consistently, in gym after gym, day after day. The moment someone finds out their core is weak, their stomach is pouching, their midsection won't firm up no matter what they do. The instinct is to train harder, to engage the core more, to do more reps, more sets, more intensity. And so they do crunches, they do sit-ups, they do leg raises and bicycle crunches, and every variation of abdominal exercise that fitness culture has told them is the gold standard for a flat stomach. Every single one of those exercises is actively widening the gap. Every single rep is making the separation worse. I want you to hold that for a moment, because it matters more than almost anything else in this video. The exercises that feel like they should be working are the exact mechanism by which diastasis gets worse. The reason is pressure. When you lie on your back and curl your upper body off the floor, your internal organs get compressed downward and forward. The pressure inside your abdomen spikes sharply. That pressure needs somewhere to go, and with a weakened midline, the path of least resistance is outward, directly through the gap. The linea alba stretches a little further with every single crunch. The gap widens incrementally but consistently every time you train this way. People do this for months, some do it for years. They work incredibly hard and move in exactly the wrong direction the entire time. Stop those exercises, not reduce them, not substitute them with a gentler version. Stop them entirely if you have diastasis. That is not optional advice. That is the foundational requirement for any healing to happen at all. Now let me talk about surgery, because it comes up early in almost every conversation about this condition, and the way it gets presented deserves scrutiny. When a gap is visible on an ultrasound, particularly when it measures 4 centimeters or larger, a surgical referral is often the next step in a standard clinical pathway. The procedure sounds clean and logical. Small incisions, the surgeon goes in, stitches the 2 muscle columns back toward the midline, sometimes lays a mesh over the repair for reinforcement, and the gap is mechanically closed. On imaging, it looks resolved. On the surface, the belly looks different, and for a period of time it holds. But there are things that conversation does not always include. General anesthesia is not a trivial event for your body. It is a chemical suspension of your brain's activity, and the research on its cognitive effects, particularly in people over 40, is not reassuring. Memory, processing speed, and mood can all be affected for weeks or months after a general anesthetic, sometimes longer. Every surgical procedure leaves scar tissue, and scar tissue does not stay where you put it. It contracts over time, pulling the surrounding structures toward it, creating restrictions and tension in tissues that had nothing to do with the original operation. And the most important thing that surgery does not do is fix the connective tissue that allowed the gap to form. Surgery addresses the gap itself, the underlying tissue quality. The weakness that caused the separation in the first place is still there after the repair. That tissue is under load from the moment you wake up in the recovery room. Recurrence is common, and a second repair on tissue that now has adhesions and scar layers from the first operation is a significantly more complex situation than the original problem ever was. None of this means surgery is never the right answer. For a very large separation combined with genuine functional impairment that does not respond to conservative treatment over time, the conversation changes. But surgery should be the option you arrive at after doing everything else correctly, not the option that gets offered after a 2-minute conversation following an ultrasound. So here is what you should do first. Here is the thing that actually works. The exercise is called abdominal drawing in, and it is built on a logic so clear and direct that once you hear it, you will wonder why nobody said it to you before. If the problem is a gap in the center of your abdomen caused by the muscle columns drifting outward, the solution is to train the muscle that pulls them inward, not the rectus abdominis, the six-pack muscle that sits on top, because training that one with traditional exercises generates the exact inward pressure that makes the separation worse. The muscle you need is the transversus abdominis. It is the deepest layer of the abdominal wall. It wraps around your torso from the back to the front like a natural corset. When it contracts, it does not generate outward pressure. It generates compression. It draws the abdominal wall inward and the 2 muscle columns toward each other. It is the only major abdominal muscle that closes the gap instead of widening it, and most people have almost no conscious relationship with it at all. The drawing in maneuver trains that muscle directly, at high intensity, and with 0 inward pressure on the linea alba. That combination is what makes it different from everything else. Here is exactly how you do it. You can perform this lying on your back with your knees bent, seated in a chair, standing, or walking. The position is almost irrelevant, which is one of the reasons this exercise is so practical. Take a breath in normally. As you exhale, draw your belly button back toward your spine as far as it will physically go. This is not a gentle engagement. This is a maximal deliberate contraction of the deepest layer of your abdomen. You want to feel your lower belly hollow out completely, like you are trying to create a concave shape where your stomach used to be. Pull it in as far as it goes and hold that base contraction. Do not release. Now begin adding short, sharp inward pulses on top of the base hold. You are trying to draw the belly button in even further with each pulse, contracting harder on top of an already contracted base. Exhale in small, controlled breaths between pulses, but never release the underlying draw. The belly stays pulled in throughout. You keep pulsing and holding until the muscle begins to fail, until you feel a burning, cramping sensation deep in the lower abdomen. That sensation is the transversus abdominis working at its limit, and that is exactly where the training response comes from. When you feel that cramping, hold for 2 or 3 more seconds, then release the tension very slowly and deliberately. Not all at once. gradually. That is one set. If you have never done this before, one set done correctly will exhaust a muscle you have never consciously pushed before. And immediately after you release, you will notice your lower belly sits slightly flatter and more drawn in than it did before you started. That is not imagination. That is the muscle in a state of temporary fatigue-induced tone, and it gives you an immediate preview of what consistent training here will produce over weeks. For a moderate separation, one set once a day is a real starting point. For a larger gap, 3 to 4 sets across the day is what gets faster results. Morning is a natural time. Midday, if you remember, before bed to finish. Each set goes to muscular fatigue, not to a rep count. When the cramp comes, you are done with that set. That is the signal, not a number. Now I want to tell you something about what is actually happening inside the tissue when you do this consistently, because understanding the biology makes it easier to stay patient with the timeline. The linea alba contains specialized cells called fibroblasts. Their job is to produce collagen, the structural protein that gives connective tissue its tensile strength and its ability to hold under load. When you apply the right mechanical stimulus to connective tissue, those fibroblasts respond. They increase collagen production. They begin to reorganize the collagen fibers along the lines of mechanical stress being applied. The tissue gradually becomes denser, stronger, and more capable of resisting the forces that caused the separation in the first place. The gap does not just get mechanically pushed closed. The tissue itself rebuilds in a way that makes closure durable. This is why the timeline is measured in weeks and months, not days. Muscle adapts quickly. You can feel the change in a muscle within a few sessions. Connective tissue remodels slowly. 6 to 8 weeks of consistent work before you begin to see measurable reduction in gap size is normal and expected. That does not mean nothing is happening. The biology is running on its own schedule, and the only thing that disrupts that schedule is stopping. There is one more layer to this that changes how you think about the whole condition. Connective tissue weakness is not local. If your linea alba is weak and slack, the connective tissue throughout your body shares that quality. This is called connective tissue dysplasia, and the word simply means your body builds this tissue in a looser, less organized way than optimal. It tends to travel in a cluster. Varicose veins, hemorrhoids, stretch marks appearing in places that barely stretched, joints that crack and move further than they should, mitral valve prolapse, where one of the heart's valves is too loose to close tightly, nearsightedness that progresses faster than average. If you have diastasis and several of those things are also familiar, you are not looking at a collection of separate problems. You are looking at one underlying issue expressed in multiple locations. Nutrition is part of the picture in a way most people never get told. Collagen synthesis requires specific raw materials. Vitamin C is not optional in that process. It is enzymatically essential, and without adequate levels, the collagen your fibroblasts produce is structurally inferior. Zinc and copper are cofactors in the same pathway. Vitamin D is a broader regulator of connective tissue health, and its deficiency is extremely common, particularly in people who spend the majority of their time indoors. If you are doing the exercise faithfully and not seeing progress after 8 to 10 weeks, get your vitamin D level tested. Not as an afterthought, as the next logical step in the process. What I want to leave you with is a reframing. The gap in your stomach is a signal. It is not a cosmetic problem, although it looks like one. It is not something that needs to be cut closed, although that is often what gets proposed. It is your body's way of telling you that the connective tissue underneath needs to be rebuilt, and that rebuilding affects far more than just your belly. When you close the gap correctly, through the right exercise and the right nutritional foundation, you are not just fixing a separation. You are strengthening the systemic tissue quality that affects your veins, your joints, your pelvic floor, your heart valves, your entire structural integrity. The belly was just the place it showed up first. The treatment improves all of it. Start the drawing in maneuver today. Do it to fatigue. Do it consistently. Stop the crunches completely. Look at what you are eating and whether your body has the raw materials it needs to build strong tissue. Give the process time because the biology requires it. And in most cases, what you are about to discover is that your body was never broken. It just needed the right signal, the right stimulus, and enough consistency for the tissue to do what living tissue does when you give it what it needs. It heals. This is Wellness Daily. If this helped you see something differently today, subscribe and share it with someone who needs to hear it. Drop your age in the comments. Tell me how long you have been dealing with this. I read everything, and it shapes every video I make next.